Maybe what we start with is really just helping us all have a big picture understanding of what arthritis really is. I think most of us kind of think of arthritis as a disease process that is going to affect us all at some point, and that there really is not a way to manage it well or cure it, that it's going to at some point affect the mobility of all of us. Sam, would you want to talk to us? I know you have some really extensive study in even at the molecular level of the process of arthritis. And so we have pet parents and veterinarians here, and it's okay to talk about it in whatever depth you're comfortable with. Tell us how you see arthritis as a disease.
Yeah, so that's a fantastic question. And there's a couple different things that I think are helpful for people, both veterinarians and pet owners, to understand. And one of the first is something that I certainly am not the one to have phrased things this way, but it's absolutely accurate. And that is, we need to think about joints as an organ. There are multiple different tissues within a joint that all need to work together in order to function optimally. And when any one of those different tissues is affected or abnormal, it affects the joint as a whole. So we can't consider just one part of the joint in exclusion of the other. And then the second really big key concept is that when it comes to orthopedics or the joint and care for the joint, we really have two areas we always have to consider. And that is the biological side of things as well as the mechanical side of things. And osteoarthritis can be initiated by either of those two or a combination thereof. So you can have a mechanical insult that damages one of the tissues, which then results in a change in the biology of the joint that progresses to deterioration of the joint. And then you could conversely have a scenario in which the biology is abnormal, and as it changes and the joint deteriorates, then you have more mechanical problems as a result of that. And so whether we're talking about the pet owner or the veterinarian, anytime we've got a patient who has osteoarthritis, we should really be considering and thinking about what are the underlying mechanics at play and how do I address the mechanics? But then also, what about the biology and how do I address and optimize the biology? Because both components are basically relevant in every case to different degrees, but both areas are relevant in all cases of osteoarthritis.
So in real life, an example of a mechanical insult, for example, so we're talking about like an injury where a dog maybe is chasing a ball and hurts himself, right? A lot of times people use the example of an ACL injury. That's kind of in my experience, a mixed bag, right? It's an example of both chemistry and physics that create damage in the joint.
So cruciate ligament disease is certainly highly complex and we don't fully understand it, but we can use it as an example to talk about both the biology as well as the mechanics. And so as an example, we know, thanks to a number of very good studies done by a number of people, including Dr. Peter Muir and his team out of the University of Wisconsin, we know that in the majority of dogs, the synovitis or inflammation of the joint precedes the mechanical dysfunction of the joint in the majority of dogs. But as this progresses, we can have deterioration of the ligament, which can then ultimately rupture. And oftentimes pet owners recognize this as being an acute or instantaneous rupture, and they think that it's a true injury when really the degenerative process has preceded it. But yet it does still culminate or can culminate in rupture of the ligament, which results in the mechanical instability, which further contributes to deterioration of the joint and other tissues such as the cartilage. And so in those situations, we talk about addressing the mechanics of the unstable knee, but it is absolutely relevant for us to be thinking about, particularly as a profession, what is the underlying biology that leads to the synovitis and the precipitation of the disease process in the first place. And that's a question that for cruciate ligament disease, we don't have kind of the ultimate answer for that just yet. But again, it's a good example. Another good example and scenario that is common in a conversation that I have commonly with owners is owners have the common perception that dogs get hip osteoarthritis and that is something that occurs in older dogs. And that is a oversimplification that's not quite accurate. So the most common cause of hip osteoarthritis in dogs is hip dysplasia. And hip dysplasia is a developmental disease that occurs in dogs as they're growing. So when dogs are 8, 9, 10, 11, 12 months of age. And the osteoarthritis is secondary to the hip dysplasia and the hip laxity that is part of hip dysplasia. And so the osteoarthritis is secondary to mechanical abnormality of the joint. And so a good number of dogs have manifestation of hip osteoarthritis even before 1 year of age. So we see it in young individuals. And it's not as simple as saying arthritis is just something that occurs over time. It's not necessarily a disease of older individuals. And so the way we should think about patients with osteoarthritis are what are the underlying mechanical explanations or contributors? What are the underlying biological contributors? And how can I address each of those two areas to maximize the outcomes for the given individual?
I think that's really well said when we're thinking about this as veterinarians, specifically when it comes to treatment path and our recommendations. As you're talking about this, Sam, something is occurring to me that I haven't really put into full thought before. And that is when I'm thinking about locations of arthritis, if we talk about dysplasia and ACL disease and that, what percentage of young dog disease do you think you see causing osteoarthritis versus old age? I think we typically think about it as you said, as an old age disease. But as I'm kind of checking off risk factors in my head, I guess the direct question is, how many patients do you see that maybe have dysplasia or parts of their body that don't fit together really well, some physical reason that they have arthritis, as opposed to what we think of as old age and wear and tear?
Yeah, that's a great question. We, as a profession, and then also owners, often think about osteoarthritis as being primary. So we talk about primary osteoarthritis and secondary osteoarthritis. Secondary osteoarthritis just means that there's some other initiating factor. The vast majority of cases of osteoarthritis in dogs are secondary. There's some other predisposing explanation or factor. So osteoarthritis of the hips is most commonly a secondary osteoarthritis, with the primary explanation being that the dog had hip dysplasia. And every dog who has hip dysplasia when they are growing and finishing growing. So those dogs have had the underlying problems since they were young. The same is true for the elbow. So the vast majority of dogs who have elbow osteoarthritis, even though some of them are not recognized till older in life, is secondary to elbow dysplasia, one of the different manifestations of elbow dysplasia. And I say that just because the term elbow dysplasia is very broad and not specific. But again, the different forms of elbow dysplasia occur in growing dogs. And so the underlying explanation for why these dogs develop elbow osteoarthritis is the elbow dysplasia that they had while they were growing, as they were young. The stifle or the knee is a little bit different, just in that the most common explanation for stifle osteoarthritis is cranial cruciate ligament disease. And cranial cruciate ligament disease can manifest anywhere from several months of age up to many years of age, but the average is middle age, 5, 6 years old, just as an average. Shoulders is a little bit more challenging and difficult. It's not that straightforward. And there's at least one good study by Dr. Smith, Dr. Runge and company out of the University of Pennsylvania, where they identified dogs at the end of life who had cartilage wear, substantial cartilage wear and osteoarthritis. And there was not a recognition during the course of their life as to an underlying predisposition in those dogs. So the shoulder is a little bit more complex or less well understood. And then some of the other different explanations, again, just to provide contrast, are you could have individuals that have injuries to the joints, where they get infections of the joint that lead to an infective arthritis rather than an osteoarthritis. But again, we're getting back to owners and veterinarians, in my humble opinion, should be thinking about what things they can do to evaluate dogs earlier in life, rather than assuming that these dogs are just going to develop osteoarthritis later in life. Because there are some things that can be done starting earlier in life that could be beneficial rather than waiting until after the dog manifests with end stage osteoarthritis.
Yeah, I love it. And Sam, I'm so glad to have you here today.
Well, thank you very much. I'm flattered that you asked me to be a part of this. I'm excited to be a part of it. It's a great program and a great number of speakers who you guys are going to hear from over the coming portion of the summit.